All right, go ahead. All right. Again, 3 pages of symptoms, but depersonalization, derealization, being in a room with people and not able to really connect, feeling kind of disconnected, emotional, vasovagal responses quickly. So now if you could come over here, let me show you what we're talking about. Please come real close to this image. Okay. So pressure in your head, that goes without saying. But really, the brain is where we live. When the brain is not happy, it affects all kinds of things, not just emotions and stress responses, but the whole thing. So here we have somebody who was a competitive horse jumper, and you're really good at jumping very high with horses, and you did it for 15 years. So we have evidence of traumas going through the through the neck here. We have these styloids that have really calcified, and you're a young man to have them this long. So we have the jugular being entrapped on both sides significantly. The dominant one is 90% blocked according to the radiologist. And then right behind the jugular, the transverse process isn't even making contact with it just directly. There's a spur. Well, actually, there's it comes across, it looks like a spur, but it's really an incomplete bony bridge. So the vertebral artery is typically enclosed there, but since structure affects function, we have this spur in there that is backing up and pushing that jugular into the styloid. So today we were very grateful that this Atlas really moved off of those jugulars, moved back, and we'll show you that in a moment. And it is, of course, on both sides. So again, you can see that. We'll call it a spur just because that's what it looks like, but it's really an incomplete bony bridge. And you can see how the jugular is completely entrapped there. And then when you bring your head down, it gets even worse, of course. And one thing the radiologist did comment on, and we see it too, is that the internal carotids are dangerously close to this styloid. So we don't want you to get into whiplash or anything. And so removing the styloids is probably something you're going to get done at some point. You'll see how well you feel from having the Atlas move back off of that. Let's minimize that. So a couple things. Look at this x-ray here, please. So this is the left side. We went through your abdomen today to push this L1, L2 back towards a more normal position, and that released your cord, I believe, and that made you feel a lot better, of course. And then over here, just picture that the jugular is sitting in front of the Atlas. This is what you look like. We even put a weight around your neck here to try to bring you back. Nothing happened. So we adjusted your Atlas, and look how far back the Atlas moved. What we're doing is we're putting a dot at the bottom of C2, and so here you can see the significant anterior head carry. You can see how the curve came back, and this was just one Atlas adjustment. Just looking at the distance, this line shows between in front of C7. The whole thing swung back. The whole thing went back. You feel lighter. What else do you want me to talk about? What else should we talk about? Oh, the ultrasounds, of course. Right.
May I?
Yeah. Go.
Mm-hmm.
Beautiful. So the ultrasounds before and after were really nice. Another little caveat here is that you had this very heavy dreadlocks that went all the way down your back. And today we cut them off at shoulder length. So we really should have weighed that, but it was very heavy. So here we did Doppler of the jugulars with your hair bundled on top of your head, with the hair down behind you. So one of the things we found is that the jugulars got significantly decreased, the blood flow decreased significantly when that hair was down and weighing towards the back. So here you can see 164 centimeters per second peak volume, and then with the hair down, it went to 110. And we can go all the way down to after the adjustment. Here's after the adjustment and after the haircut. 172 centimeters. We see a lot more blood is coming out, and you felt a lot better, of course. And then the left jugular, that was the big one. So left jugular with your hair up on top of your head, balancing on top of your head, which having that weight is not great for any hypermobility you have in the upper cervical spine from the car accidents, which you do have. So it went from 112 down to 52. So look, hair on top of your head, hair down, let your hair down, significantly shut down the left jugular. Then when we actually picked up the weight of your head, of your hair, taking the weight of your hair off, actually that's the right jugular. So the left, here's the left jugular after the adjustment, 109. So it opened up pretty good. Okay, so you actually have a large atlas. Your atlas comes really close to the mastoids, just the way you're built. Let's see. Here's a good shot of the extra calcification that we have going down on the right side because of injuries that you've had. Elongated styloids. Down here we have the first ribs drop down, particularly on the right side. Again, another shot of that. Your jugular being entrapped. The other jugular. There's that spur or incomplete bony bridge. There's another shot of it. And we did left and right head rotations to see if this spur is coming to where it would puncture the jugular. And it looks like it's just barely not there. Although if you were in a whiplash or some sort of trauma, it is dangerously close, and the jugular does kind of fold right on the corner there. This is a center line of the foramen. Looking to see how the atlas is aligned. The whole atlas is forward. We see that the odontoid is not in the center. We ended up adjusting you anterior from the left to try to bring that, to reduce that distortion there, that subluxation. There's another little alignment there. Doesn't look terribly bad there. Yeah, there's the C2, how C1 is not sitting on C2, spur, jugular. The big offset here. So you can see the C2 is kind of a shelf there, and here it's flush. Obviously you see the big spaces there. So we tried to reduce that, and that seemed to help you today. Yeah, showing how the styloids are close to the internal carotids, and we don't like that. There's another shot of it. Again, the spur, left head rotation, how it slides up to the right. So here's left head rotation. So we look to see if how the atlas rotates and moves and slides, and it wasn't really too bad. It kind of didn't move much at all. There's your C2 rotation, C2. Another shot of that spur, trying to see how close it comes to this jugular. Extra injury, joint capsule back here got injured a while ago, so it ended up calcifying. Here's another one. So this is actually two different states of healing. So here we have a wedged joint capsule. So we like the idea of PRP being injected in here to let this thing heal up. That other one that we just showed you a moment ago, probably old injury, it never really healed correctly and started to calcify. So now that when we checked left and right head rotation, it didn't really move like the rest of them. The rest of them moved pretty good. There's another shot of it. Yeah, showing how close your skull gets to C2 with left head rotation. This is right head rotation. Again, we were checking the spur approximating the jugular, and you seem to be okay. Right head rotation. Again, right head rotation. There's some hypermobility in there where the odontoid is touching the skull. Another shot of that. This is now on the MRI. You have a disc injury here that's actually putting pressure on the cord, and this is where you can see that it's moving more than it should. So the burden of motion should be evenly dispersed throughout the cervical spine, and this is an injury here. And you should get that checked out. There's a lot of doctors that are really good at that these days. And that's it.